So thank you so much, everyone, for joining us. My name is Emily Wheeler, and I'm Head of Philanthropy and Partnerships here at MQ Mental Health Research. And here I'm talking to you today about some of the work MQ is doing, particularly around supporting young people's mental health. I'm really delighted to be joined by Andy Ward, who's a VP Talent and Development and a Mental Health First Aid at Deutsche Bank. Andy, can I ask you to say a quick hello?
Hi, great to be here. Thank you.
Brilliant. But before I begin, I just also need to let you know that I am not a psychologist, I am not a medical professional, and I'm not here to give any personal advice about treatment or anyone's individual circumstances. Instead, I'm just here to tell you a little bit about the work that MQ does in this area and how you can get involved in that. So, heading over to our first slide. So now, I'm not sure if you know, but 75% of mental illness starts before the age of 18. And poor mental health in childhood can have lifelong impacts. However, only a quarter of mental health research actually goes into this area. MQ is actively changing this, and part of our strategy is to really challenge inequalities, including the inequality of investment in under-researched areas like children's mental health. So since MQ was founded in 2013, we've invested in creating a brighter future for the next generation. But before I talk to you about some of our research projects, I first want to talk about the current state of children and young people's mental health. So back before COVID struck, if you can remember those times, there was already a serious lack of funding and support for children's mental health services. In October 2019, Children's Mental Health Services, or CAMS as it's known, accounted for less than 1% of all NHS spending. In England, prior to the pandemic in 2017, a House of Commons Select Committee report found that 338,000 children were referred to CAMS, but less than a third of those received treatment within that year. The local government association found that 1 in 4 children referred to treatment specialist services by GPs or teachers are turned away without any signposting to alternative support. And around 75% of young people experience a mental health problem, are compelled to wait for so long that their condition deteriorates or they are unable to access any treatment at all. So far, the studies that we've talked about have been specifically about how COVID viruses have impacted mental health. But what about the stress of the pandemic itself? And particularly, how has it affected the most vulnerable group of all, which is children? So as you can imagine, things have largely gotten worse for the COVID generation. Mental health issues amongst children were already on the rise even before the pandemic struck. And in 2017, 1 in 10 children suffered from a diagnosable mental health disorder. In 2020, the figure is now 1 in 6. That's more than 3 children in any classroom. As mentioned already, in 2017, 338,000 children have been referred to children's mental health services. However, over the last year, referrals to CAMS have increased by 35%. And in fact, just 3 weeks ago, figures were published in the Royal College of Psychiatrists that show nearly 200,000 young people were referred to mental health services between June and August this year in just 3 months. It's also worth adding that these are just referrals. So previously, as in pre-pandemic times, 80% of referrals were turned away with no signposting or alternative support. The survey that I mentioned was produced by MQ, the Mental Health Foundation, and Swansea University. And this summer found that 50% of teenagers are now pessimistic about the future. There isn't enough data on the state of young people's mental health, which is why it's such a key area for research and why this survey was set up. So many school-aged children struggled during those lockdowns, in particular young people with pre-existing conditions and disabilities from disadvantaged or marginalised groups. The NSPCC reported an all-time peak increase of 32% in distress calls to their helpline during the first UK national lockdown. However, it should be said that some children found their mental health actually improved whilst during the lockdown and while spending more time at home. Understanding why some people saw an impact poorly on their mental health while others weren't would really help us to understand much better how we support these young people going forwards. So some of the research done into the impact of COVID-19 has found that young people may be one of the most vulnerable groups, alongside women and job seekers, those who are more likely to experience negative mental health outcomes during the pandemic. And this is a brilliant quote from one of our supporters, Professor Matthew Hotov, when he was appearing on behalf of MQ at the House of Lords inquiry into the impact of the COVID pandemic onto mental health. And as he says here, the group which is least at risk of mortality when it comes to the COVID pandemic are actually paying the greatest price, potentially in terms of social, economic, and educational impact, and that is being seen in the mental health consequences on those young people. So what are we doing about this? That's obviously a lot of quite scary and worrying statistics, but this is one of the areas, and that is one of the reasons why MQ has been really leading the way over the last year in taking all of these research findings and sharing them with policymakers. So in April, MQ led the all-party parliamentary group for a fit and healthy childhood to publish a report on the state of young people's mental health. The paper, which was titled The COVID Generation, a Mental Health Pandemic in the Making, the COVID Generation, was produced by 41 experts and academics in childhood development and mental health and was sponsored by MQ. It made a number of evidence-backed recommendations to the UK government in ways that they could protect the mental health of children and young people. This included better support for young people and vulnerable children in schools, having different groups work together to improve support across the UK, allowing researchers to access routinely collected healthcare data so they can get more up-to-date information, and of course, more funding for research. Following this report in May, the then Education Secretary, Gavin Williamson, announced a £17 million boost in funding for schools and students to help them recover to the impact of the pandemic. This is including a £9.5 million investment to train a senior mental health lead from existing staff for up to 7,800 schools and colleges. In addition, £7 million to train other staff working with children, and the Department of Education funded LINK programme to get educators and healthcare leaders working together, as well as a new staff charter to also, of course, protect teachers and their colleagues. So by using our network of experts and evidence-based recommendations, MQ successfully influenced government policy in a positive way to really help protect members of the COVID generation. And this is the kind of change we want to see, and more researchers, scientists, clinicians, therapists, teachers, and policymakers all working together to see real change that improves people's lives. There we go, so some of those statistics there. So in terms of talking about policy changes, one of MQ's other research studies helped to influence another UK policy change this year. So it's been known for quite some time that folic acid protects fetuses from developing conditions like spina bifida. But pioneering MQ research has also proved that taking folic acid during pregnancy can protect against children developing psychosis. And this has led to a recent and really significant policy change in the UK. Now, bread products are going to be fortified with folic acid to help protect children. And up until now, the UK was one of the only Western countries that didn't fortify foods, and it was partly MQ's study that pushed that over the line. Another influence of our work is guidance for educators. So MQ invested £225,000 into a study led by Dr. Pingo, who was examining the impact of bullying on mental health. Dr. Pingo had a quick win very early on as he was able to prove the link between childhood bullying and adult mental health problems. And with MQ support, he was then able to develop practical applications through his research, and last year, new guidance was issued to schools throughout England and Wales. So through that really targeted investment from MQ, millions of children now in the future will receive better evidence-based support. And this is something that could really have helped one of our ambassadors, AJ Soni, who is a spoken word artist. AJ was bullied throughout his time at school, and it wasn't until he was an adult that he was actually then diagnosed with autism. And AJ now uses his experience to raise awareness around mental health issues through his music, and has met all sorts of celebrities such as Stormzy, Rita Ora, and Russell Brand. One of MQ's biggest projects actually was investment into a project that aimed to speed up research by creating an unprecedented new resource for scientists and policymakers. Thousands of pieces of data are collected every day, whether that's in schools, GP surgeries, hospitals, and this data provides crucial insight into young people's mental health and can really help us tackle some of those major challenges that young people face today. But right now, it's time-consuming, it's incredibly difficult for scientists and policymakers to get the results that they need from that data. So the MQ Adolescent Data Platform, or the ADP, anonymously brings together all of this data together under one roof, preparing it so it's easy to work with and speed up that research. In total, billions of pieces of data are included in that platform, ranging from administrative health, social and education data to psychological and clinical data, as well as information from actual research studies. So this is all held within the secure data bank at Swansea University Medical School, And this currently is the project only active in Wales, but it has the biggest of its kind. And the project has already led to new guidance issued to teachers and local authorities about self-harm, as well as advice of primary care practitioners on depression management in young people. The ADP project was led by Professor Anne John from Swansea University, and due to its success, she has now been awarded a further £2 million in funding from the Medical Research Council for a UK-wide HUD called DataMind. So this additional funding and much larger UK-wide project was only made possible by MQ support of the ADP. This will also allow a wide range of collaborations amongst schools, clinical institutions, universities, charities, and industry to advance mental health in a really holistic manner. So at least half of young people in care very sadly experience a mental health difficulty. Sadly, many of those children in care have experienced abuse or neglect, which can lead to long emotional and behavioural difficulties with lifelong impacts. However, many have little to no access to the help that they need. So one of our MQ researchers, Dr. Rachel Hiller from the University of Bath and her team are using untapped data from local authorities, the NHS and schools to try and resolve this. This data will help them see what kind of mental health profiles children have when they come into care, how mental health difficulties develop over that time, and how their services are responding. This will give a much clearer picture of the issues facing young people in care by better understanding what their needs are so they can get the support they need much quicker. Rachel and her team will share their work and findings with other scientists and social care services across the UK, giving them the tools they need to expand the reach of this important work. And the IDEA project is the last one that I'm going to talk about before I invite Andy to speak a bit about his experience and his passion around young people's mental health. But I've saved the best till last, as this project really is truly groundbreaking. So the IDEA project is an international study that spanned the UK, Brazil, Nepal, and Nigeria, and used biology, genetics, sociology, and anthropology to successfully develop for the first time a tool that could predict which young people are at risk of developing depression in later life. And I'll let that sink in a little bit. Imagine the impact that tool can have. If every school and GP surgery in the world could use this tool to determine if a child is at risk, then they can make sure that that child gets the help to stop clinical depression before it takes hold. Just think of the generational impact that that one study can have. I'm going to stop sharing my screen now so I can hand over to Andy. As I say, he can tell us a little bit more about his experience and his passion for young people's mental health. So Andy, over to you.
Thanks, Emily. And just a quick apology to all. I'm suffering from quite a cold today, so if I cough or splutter, I apologise in advance. Look, this is something that's super important to me, right? So my story, very briefly, I currently, as Emily said, I'm currently based at Deutsche Bank. I'm working in our talent and development division. I'm also a trained mental health first aider and was part of the original team that brought mental health first aid into Deutsche Bank in the UK. And as a result of that, I'm now a board member for Mental Health First Aid England here in London. So look, my story very briefly, I have always been someone that has always wanted to say yes to things. I've always been someone that's wanted to get ahead, right? That's not from ego, that's simply because I feel that my validation comes from a place of doing a good job and making people believe that I'm doing a good job in things. Sadly, in 2018, this sort of boiled over to a point where I had taken on far too much, both in my working life and in my personal life, which resulted in a period of time which I now refer to as the Great Reset, right? So from the end of July 2018 through to the beginning of November of that year, I had 3 months where I reset my life. I stepped away from work. I stepped away from a number of family commitments and gave myself the time really to reset, to learn more about myself, to understand why I was suffering with anxiety and depression, where it had come from, how I could mitigate it going forwards, and then really what I could do to try and educate people, to try and help people and try and support people who may be feeling something similar, and ultimately with the view and the goal of helping at least one person not to have to go through what I went through. In terms of the topic that we're looking at today, in terms of young people's mental health and how we view mental health in our young people, look, I often wonder, right? I often sit and think, what would my journey have been like had we had a better understanding of mental health of young people? Whether if we didn't use phrases like kids will be kids and, oh, it's a behavior that they'll grow out of, and actually had a deeper understanding of something that could be there and something that potentially could be treated or mitigated against, would my journey have been any different? Would I have had better tools, better coping mechanisms, better ways to give myself time out, give myself The ability to sort of take stock and understand what was happening, very probably. What's been very interesting for me, so I'm someone, I don't have children, but I have an infinite number of siblings and siblings-in-law, all of whom do. And I've witnessed a dramatic change in behavior over the past 18 months. Now, whether that's, in particular individuals, particular children that are in my family that have seemed to come through this whole thing quite strongly, and it doesn't appear to have affected them, through to some individuals who have had a marked change in behavior, resulting a few weeks ago, actually, in an informal conversation I had with one of them of the word feral being used. And that for me just really brought it home, right? What's happened in the consciousness of that child or those children to have had such a marked effect on their behavior? How can we understand better about what's happening in terms of those behaviors, and what can we do, right? What can we do in terms of support, but what can we do to really understand it? And something that really speaks to me in terms of the work that MQ are doing is around, without research, it's just guesswork, right? And that's something that has really, it's landed for me in a way that I didn't expect that it would. A lot of the therapy that I had through my journey, a lot of the medication that I took during my journey, there's good amounts of research, right, that show that the medication especially, is worthwhile and it helps for an individual that can benefit from it. But a lot of the other things, a lot of the complementary therapies and talking therapies, yes, there's anecdotal evidence, right? And there's a number of years or decades of experience-based evidence. But how do we know, right, what's actually happening underneath? And how do we really drill down into getting a better understanding of what that looks like? And so the idea now that we are in a position, we're in a place where, the world is moving forwards, hopefully, from this pandemic state that we found ourselves in. The WHO themselves have said that something that could be on the horizon now is a pandemic around mental health. What better time to invest in research and understanding, right, where our populations are, what the challenges are that people are facing, and where those challenges come from, right? Is this something that we're talking in terms of genetics and inheritance? Is this purely behavioral? Is this nature versus nurture? I think so many of those questions still remain unanswered. And even in my profession, in terms of how I work with people around mental health and well-being, in a lot of the training that happens through companies like Mental Health First Aid England, who are trying to raise awareness and give people the skills to be able to have conversations around mental health, like how much of that is going to be able to move on if we have a deeper and more almost clinical understanding, right, of what's happening in the background, and the sort of complementary therapies that we may be able to bring as a result of that. Emily, I'm not gonna lie, my throat is starting to hurt. So I could talk for hours about the experiences that I've been through, right? And I don't want to suggest that my story is unique, because it's not. Working in the city, I'm one of a large number of people that will have experienced these types of feelings and these types of problems and challenges around my mental health. I think one of the benefits that come from experiencing something is that you learn how better to live your life so that you don't experience it again, right? But we shouldn't live in a society where people need to go through something in order to properly understand and mitigate going forwards. And I think the earlier that we can do that, and the earlier that we can work with our young people and make sure that they understand the importance of taking care of themselves and understanding their mental health and understanding where feelings come from and how best to deal with them, it's going to set us up for a whole, better equipped generation of future adults, right? And that's got to be good for the world in general, to know that everybody hopefully is coming to work, is coming to their personal life, is coming to whatever the challenge may be in front of them, but they're coming to it with an understanding and a toolkit, a skill set of why we feel the way we do, why we react the way we do, and what we can do to make sure that we keep track of it, keep on top of it, and ultimately, live the best lives that we can.
Fantastic. Thank you so much, Andy. And I think you've hit the nail on the head there right at the end. Is, the earlier we can start with this, the earlier we can hopefully stop these things from happening and someone having to go through that in the first place. And, that speaks exactly to the idea project of being able to identify those people most at risk, and perhaps that sometimes just letting that person know that they are most at risk and what can you do about that. So I think that's absolutely key, and it's amazing to see the work you're doing at Deutsche Bank. And then, what there could be replicated to make sure that happens earlier. It doesn't just wait until someone ends up in the workplace and then realizes they need to seek it out. Thank you
And
so
that's
much,
it.
Andy.
Just on that point as well, right? That we're seeing now a lot more support, which is great, right? We're seeing a lot more support for young people in school, for young people as they go through university. Obviously, there isn't parity there. I'm not suggesting that it's going to be the same everywhere, but we are seeing a new generation of individuals coming into the workplace who expect more around their well-being, right? And expect companies to take more note of the well-being of their employees. And I think that movement, that swell is only going to grow. And I think, with projects like you've mentioned already, and with the additional research that starts going into this from a company point of view, from a workplace point of view, like, we need to be aware of this. We need to be on it now. We need to be understanding and listening to our youngest members of staff, our newest members of staff that are coming in with a different perspective. And actually, rather than trying to pass it off as, well, this is how we've always worked, this is how it's going to be, we need to be learning. We need to be moving forward. We need to be making sure that we're taking care of the next generation that ultimately will be leading the companies in the future, right?
Yeah, that's such a good point, that there is, obviously, with this movement and the way we've been talking about mental health more and building the understanding of it, that new generation coming through have possibly got a greater understanding of it than those who are in the workplace already. So it's, fantastic you say you need to listen to those young people with a different expectation, and a very right expectation of making sure that there's that support there for their mental health, as well as there is and has been for millennia in terms of their physical health. Brilliant. Thank you again so much, Andy. I'm going to start sharing my screen again, so bear with me while I bring that up. Perfect. So in our last few minutes here, we're just going to go through a little bit more background, as I say, on the kind of who is MQ and how you might want to get involved if you've been inspired by some of the things you've heard today. So as we've mentioned, those are just a few of the research projects, and MQ has invested in over the last 8 years. So through funding research, we aim to achieve 3 things. So firstly, to improve our understanding of how and why mental illness first occurs, just as we've been speaking about, and that will help to speed up diagnosis. Secondly, to improve our treatment of mental illness, because we believe that everyone should have that rapid access to a mental health treatment that works for them. And thirdly, to work towards preventing illness before it even begins. So looking at the factors that might put people at risk and developing interventions to stop mental illness developing in the first place. We essentially want to do what mental health does to happen to Cancer Research UK has done for cancer. So in terms of how you can get involved, there are a number of different ways if you want to be part of that future of mental health. So we are a charity, and we do rely on donations to fund our work. So if you have been inspired by any of the discoveries that we've mentioned today, then please feel free to chip in a couple of pounds each month, and you can sign up on our website. Secondly, you can get involved by taking part in research through our Participate platform. So Participate is a website run by MQ where anyone can volunteer to take part in real research studies. Many of these studies are online, but some are in person, and the researchers often need volunteers both with and without symptoms of mental illness. So there is something for everyone there. And lastly, if the company you work for runs a charity partnership scheme, then why not nominate MQ? And if there does happen to be anyone from Deutsche Bank here on the webinar today, please do make sure you vote for MQ this week, and voting is open until the 29th of October. So there are many initiatives for mental health out there, lots of awareness raising campaigns and service being offered, but as Andy so brilliantly said, without the research to back it all up, it is just guesswork. If any of you have any questions at all, please do just reach out to a member of the MQ team, and we would be very happy to help. And Andy also fantastically teed me up for my last slide here, is that our last webinar in this series is actually looking at mental health in the workplace. So if you've enjoyed today's webinar, then please join me again on Monday, where we'll be joined by Jeff McDonald, who is a mental health campaigner and expert on mental health in the workplace. So we'll be discussing that more then. So as mentioned, if you do have any questions, please do reach out to any of us at MQ, and we'd be very much happy to help. But otherwise, thank you so much for joining us, spending your lunchtime with us. And we hope to be speaking to you again soon, and hopefully see you all on Monday.